Hello friends, once again welcome to the new session of Hospital and Clinical Pharmacy. Myself, Miss Malvi Rajendra Bhavsar, M.Pharm in Pharmaceutics. So today we are going to start with a new chapter, that is drug abuse and drug dependence. Learning outcomes. After watching this, student will be able to learn concept of drug abuse and drug dependence, difference between drug abuse and drug dependence, treatments and withdrawal symptoms. Introduction. The use of a drug for a non-medical purpose is becoming increasingly common, especially among the younger age group of society. The indiscriminate use of drug is becoming a serious public health and social problem. Repeated administration of drug causes habit and dependence. If the habit-forming drug is not made available to the patient, then withdrawal symptoms occur. These symptoms are psychic disturbance like headache, restlessness, emotional upset, or physical disturbances like convulsions and vasomotor collapse. So, important terminologies related to drug abuse and drug dependence. First, drug abuse. It is defined as the consumption of drug apart from medical need or unnecessary quantities. Drug misuse. It can be defined as use of a drug for the purpose of a condition for which they are unsuited or even their appropriate use, but in the improper dosage. Drug addiction. It is a state of periodic or a chronic intoxication produced by repeated consumption of a drug in natural or synthetic. Its characteristics include: first, overpowering desire or compulsion to continue taking the drug and to obtain it by the means. Second, a tendency to increase the dose. Then, drug tolerance. It is a state of decreased responsiveness to the pharmacological effect of a drug resulting from prior exposure to the drug. Then, comparison between drug addiction and drug habituation. First point, addiction. It is a state of periodic or chronic intoxication produced by repeated consumption of drug, whereas habituation is a condition resulting from repeated administration of drug. Second point, an overpowering desire or a need to continue taking the drug and obtain it by any means. In drug habituation, a desire that is not a compulsion to continue taking the drug for a sense of well-being that it is produced. In drug addiction, tendency to increase the dose. In drug habituation, there may be little or no tendency to increase the dose. Fourth point, effect of drug produces both psychological and physical dependence. An effect of drug produces some degree of psychological dependence but no physical dependence. And hence there is an absence of abstinence syndrome. In drug addiction, effect is detrimental to the individual and to the society. In drug habituation, a detrimental effect, if any, primarily on the individual. Then, drug dependence. As per the definition by World Health Organization, it is a state of psychic and sometimes physical in which the user has compelling desire to continue taking the drug either to experience its effect or to avoid discomfort or its absence. Drug dependence is generally a general term in which it is applicable to all types of drug abuse. A person may be dependent on more than one drugs. The term drug dependence is now used instead of term drug addiction or drug habituation. So, first, psychological dependence. Psychic dependence, psychic carving, compulsive abuse is characterized by an emotional or a mental drive to continue taking a drug. And in physical dependence, it is a state that manifests itself by intense physical disturbance when the administration of drug is suspended. It is an altered or adaptive psychological state produced in an individual by the repeated administration of the drug. Then, the classes of drug commonly used for the abuse and their effect are shown in the table. Okay. So, first class is narcotic. Examples: opiate. Psychological dependence is strong, develops rapidly, and physical dependence develop at early stage, which is increased with increase in dose. Then second category is general depressant. Example: alcohol and barbiturate. Psychological dependence is mild to strong and then develops slowly. Physical dependence develops slowly but to marked degree. Hallucinogens, LSD and marijuana. Psychological dependence is variable, physical dependence is none. CNS stimulant like example amphetamine and cocaine. Psychological dependence is mild to strong and physical dependence it is a low degree. Treatment aspect. So there are two treatment aspects. First is detoxification, second is rehabilitation of patient. Detoxification refers to freeing the body from adverse effect of the drug. It is done by stopping the drug, taking medical treatment for the various withdrawal symptom. It is usually between 10 to 21 days and can be done on outpatient basis or admitting the patient depending upon the severity of the problem. Detoxification is followed by the long-term treatment, as otherwise the relapses are very common. And second method is rehabilitation of the patient. It is a part of long-term treatment depending upon the patient needs. After detoxification, psychotherapy, family therapy, behavior therapy and a group therapy are used. Self-help groups like Alcoholics Anonymous or Narcotic Anonymous also play an important role in treatment of drug dependence. Facilities for the treatment of drug dependence are woefully inadequate now. They should be created all over. The public should be educated regarding adverse effect of drugs. Certain high-risk groups like student, unemployed youth, industrial labor, migrant worker need constant monitoring. Legal measures should support the medical aspect. Then important drug abuse and their treatment. So first one is alcohol, that acute alcoholism. The enzyme alcohol dehydrogenase is responsible for the metabolism of the alcohol. It metabolizes about 10 mg pure ethanol per hour. And the features of acute alcoholism depend on the blood level. So if 20 mg per 100 ml, feature will be feeling of warmth and relaxation, 30 relief for anxiety, 50 mg per 100 ml will be in coordination, euphoria, speech mistakes, 100 mg per 100 ml will be ataxia, 100 to 200 will be vomiting, imbalance and vertigo, 300 mg per 100 ml stupor, 400 mg respiratory depression and coma. The treatment is supportive to maintain the respiration, blood pressure and body temperature until the ethanol is removed from the body by metabolism or hemodialysis. If intracranial pressure is increased, administer hypotonic mannitol solution intravenously. Phenothiazine is used to control the psychotic behavior. CNS stimulants should not be used as these may cause convulsion and give artificial respiration and electrolyte for balance. Chronic alcoholism, it is a result in development of tolerance and then the physical dependence. The withdrawal of alcohol results in tremors, fits, anxiety, insomnia, confusion, GI disturbances like chronic gastric, peptic ulcer, hepatitis, cirrhosis, pancreatitis. The abrupt termination after a longer period of alcohol abuses can lead to delirium tremens like fever, tremor, tachycardia, agitation, sweating, hallucination and convulsion. It also results in myopathy, bone marrow suppression and gout. So treatment for chronic alcoholism consists of counseling and attention to social and behavioral factors, support to social interaction like Alcoholics Anonymous. Follow-up, it also requires pharmacotherapy with anti-anxiety agents and aversion therapy using disulfiram. Give diazepam 40 mg daily for 4 days, 30 mg daily for 3 days, 20 mg daily for 2 days and 10 mg for 1 day. Give intravenously 10 mg state, then 5 mg every 5 minutes until calm. Supplemented with haloperidol 2 to 4 mg every 4 to 6 hours. Then barbiturates, if taken orally, IV or subcutaneous. The chronic abuse of barbiturate result in drowsiness, ataxia, reduced quality and quality of work, increased appetite, impaired motor coordination, confusion, emotional instability and poor judgment. Withdrawal symptoms are range from anxiety, confusion, insomnia, anorexia, panic attack, tremor, delirium, disorientation, hallucination and fits. Sometimes status epilepticus. So treatment for this, gradual withdrawal of drug by decreasing the dose over a period of 3 weeks and then psychotherapy is recommended. CNS stimulant like amphetamine, take orally, intravenously or sniffed. These drugs are widely used for CNS stimulant effect by student, athlete, truck driver, executive, doctors and nurses. The therapeutic dose of amphetamine is 5 to 15 mg per day. It induces physical dependence. Its acute administration results in excitement, euphoria, little need for sleep, anorexia, psychotic, schizophrenia-like reaction, tachycardia, arrhythmias, hypertension and fits. Cocaine when sniffed can lead to ischemic perforation of the nasal sputum. Withdrawal symptoms include depression, fatigue, muscle pain, hyperphagia, hypersomnia and lethargy. Treatment is 8 mg of reboxetine per day is recommended for at least 2 weeks. However, this drug is still in the trial stage. No other available treatment has been effective in the treatment of amphetamine withdrawal. Cocaine. The chronic use of cocaine results in the following systemic effect: CVS, myocardial infarction, arrhythmia, CNS irritability, anxiety, hallucination, insomnia, visual disturbance, for GIT, nausea, weight loss and gangrene, urogenital difficulty, erection and delay in orgasm in both sexes, respiratory perforation of nasal septum, pulmonary edema and rhinitis. Treatment is regular supportive therapy with tricyclic antidepressant and tranquilizer. The vital function of cardiovascular and respiratory system should be monitored. Narcotics like morphine, opium, heroin, codeine and pethidine. The abuse of narcotic results in syndrome consisting of drowsy and relaxed feeling, restlessness and excitement, pinpoint pupils, malnutrition, vitamin deficiency, thromboembolic complication, constipation, hepatitis, vasculitis infection, especially AIDS, pulmonary edema, cardiorespiratory collapse and coma. Withdrawal symptoms include sudden withdrawal of opiates. Develop the following symptoms: after 8 hours, yawning, sweating, anxiety, tearing. After 20 hours, goose flesh, chills, sweating. 24 to 48 hours, nausea and vomiting, diarrhea, fever, hypertension. Up to 1 week, muscle cramps. Up to several weeks, insomnia. It is accompanied by craving of drug. Treatment: the symptoms can be suppressed by substitution of another narcotic for opiates, like example methadone. 20 mg is divided dose for first 3 days and then 10 mg for 3 days. Newest compound is levo-alpha acetylmethadone, which is longer acting drug which is used for narcotic addiction. This drug is superior to methadone as it is not to be administered daily. The naltrexone is another drug acting antagonist used for treatment of narcotic addiction. Hallucinogens are the group of naturally occurring compound and synthetic compounds capable of producing profound distortion of reality, resulting in confusion, delirium, amnesia, and loss of sense of direction, space, and time. Cannabis, when taken orally or smoked. Product of cannabis sativa are available in two forms: hashish, that is resin obtained from the flowering top, and marijuana, chopped loose and stalk. The other products are charas, bhang, ganja. It is produced by psychic dependence only. So the effect after 1 minute of inhalation of adequate dose of feeling of floating and drowsiness, increased sensitivity to external stimuli resulting in disordered perception of time, color, music and distance, social relaxation, memory impairment for short term. Hallucination, coordination, panic and delirium may recur after intoxication has worn off. There may be confusion, disorientation, psychotic reactions. Major psychoactive ingredient present in cannabis is delta-9 tetrahydrocannabidiol. Chronic abuse of cannabis result in mild dementia and personality changes. Treatment is quiet environment and measuring attitudes help during the acute psychotic phase in the management of overdoses. The extreme agitation is the best controlled by diazepam. LSD, lysergic acid diethylamide, is the most potent hallucinogen currently available in the form of tablet, thin square of gelatin or imaged paper. The average effect of oral dose is 20 to 50 mcg. Volatile inhalants, volatile liquids are commonly placed on the handkerchief and inhaled. The effect produced are CNS excitation, dizziness, auditory or visual hallucinations, tinnitus, blurred vision, slurred speeches and staggering gait. The larger dose may result in unconsciousness, delirium, stupor, coma, cardiac arrest and death. Amyl nitrate inhalation has been abused as sexual stimulant. Treatment: it is similar to that of barbiturates. Oxygen and other supportive treatment is required. Thank you very much for the listening. Thank you, friends.